Hello, everybody. This is Dr. Bob DiMaria, and today I want to talk to you about peripheral neuropathy. We're going to talk about B12. There are so many pieces to the puzzle when it comes to peripheral neuropathy. You maybe didn't ever think about being a B12 deficiency being a part of the problem, but it can be. B12 is really important to help make something around the nerve. And this is an example of a foot, and the yellow here, those are nerves. The covering of a nerve is called the myelin sheath. Now, you may be experiencing tingling, numbness in your feet, poor balance, difficulty in walking. Those are potential body signals of a vitamin B12 deficiency. So what I have discovered over time, you could measure your B12 levels indirectly. So this is important. You want to look at your blood test, because I know so many of you had so many tests done so far. You want to look at something called MCV, MCH, or MCHC. Those tend to elevate when someone has a B12 deficiency. Also, if you look at your blood tests, you have a level called uric acid. If the uric acid is low, it could suggest a B12 deficiency. Why would you have a B12 deficiency? Because maybe you're taking a drug for medication to lower your digestive distress. Now, with that, you're not going to absorb your nutrients. You don't absorb your nutrients. A common one is a B12 deficiency. So in our practice, when somebody comes in, and this is so significant, we do sensory testing. We'll check your gait. We'll see how your balance is, because those are some important markers. We also look for nitric oxide levels. B12 is often overlooked, and in the practice, we use a three-tier approach to help improve overall function, including B12, through what we call neurochemical. In other words, we're going to support your digestive system so you'll have a better chance to have more B12. At the same time, we'll use an instrument that's going to help increase the blood flow to your mitochondria that's going to help support peripheral neuropathy healing. I'm Dr. Bob DiMaria.